Welcome to this second video to support those students that can't be with us due to the COVID restrictions. Actually, towards the end of the video we will have a think about how COVID-19 has possibly affected the demographic transition or maybe the population pyramids of countries in the future. So as we said before, the challenge that we have with models is that they are a simplification. Of the real world. So they attempt to replicate or predict reality. They attempt to predict the future. They're there to help us to understand complex systems. But the problem is, as soon as you start simplifying things, you lose that important detail. And one of those things that models such as the demographic transition model really find it very hard to cope with are unexpected high impact events. And these are sometimes called black swan events. So with the emergence of HIV and AIDS in the 1980s, it did have a huge impact on the population structure of many countries, in particular those countries in sub-Saharan Africa that didn't have healthcare systems that were able to control the spread of AIDS and HIV. So there's a video here for you to watch. It really was a terrible, terrible situation that sub-Saharan Africa was placed in, and there were some poor communities in sub-Saharan Africa where maybe over half the population had HIV and AIDS. This is particularly significant from a demographic point of view because it's those people that are sexually active that are more likely to be exposed to the HIV and AIDS virus. It was also not helped by some cultural factors. So, for example, the president of Zimbabwe, Robert Mugabe, over the past 2 decades has really not helped the situation. So you've had internal conflicts with these countries, which makes it very hard to control the spread of AIDS. And there are also some cultural attitudes towards AIDS that were very prevalent in sub-Saharan African countries that made the control of AIDS very, very hard to control the spread of AIDS. So there are cultural aspects here, there are political aspects, there are social aspects, and of course there are economic and environmental aspects that together really did cause, I suppose you could call it, the perfect storm. So that's not a term that I like to use. So with AIDS and HIV, it really was one of those black swan, high impact, almost impossible to predict events. So you can watch the additional video here, which goes through the issue of Zimbabwe and HIV. Thankfully, HIV now, through the use of retroviral drugs, is comparatively treatable. You cannot cure a person. I think I'm correct in saying this. I'm not a doctor. You can't cure a person 100% of AIDS, but for all intents and purposes, you can stop them from HIV developing into AIDS. So, but those drugs were not available back in the 1980s. So if an individual was unfortunate enough to get HIV, and that was developed into AIDS, it really was a death sentence. And the other thing here as well is that when the child was born, if the mother had AIDS, she would transmit HIV to the child, which would then develop into AIDS. So in particular, this had a huge impact because you had a large number of people dying of childbearing age, and you will see that this has a huge impact on the population pyramids. So really that stopped countries from progressing through the demographic transition model as we normally would expect them to move through the model. Now things have changed Now HIV and AIDS are comparatively controllable. You can actually stop now, with the correct drug regime, a baby from contracting HIV from its mother. So thankfully we are not in this situation, but the scars of HIV and AIDS can still be seen in the population pyramids of countries like Zimbabwe. So the next video, I'm not going to make a video about population momentum, because there is actually a very, very good video on the next slide from my colleague in Canada, and he explains very, very well the concept of population momentum, which we did briefly consider in one of the previous classes.